So I think for all three of you, I suppose, this won't be the first time you heard of AI and AI kind of disrupting things, right? And it's been talked about by people way smarter than me and more capable than me in that area. But this has been my world since before it was cool. So it's an area that I've built multiple businesses on, and all in the healthcare, which we'll talk about in a little bit. But one of the things I think is really important to appreciate is that we cannot sustain what's coming. And it's not about how great our people are. It's the fact that there's not enough people for the demand that is coming in for services such as OT, physio, care workers in general, right? And Australia has a bigger issue there, is that not only do we have a staffing crisis, we're also geographically so spread. So there's some interesting going on, particularly after COVID, with virtualization of care. So mental health has taken a big virtualization component. Allied health is doing the same. There's some organizations that are providing sort of virtual services. This is all in the nature of dealing with demand, and AI is one of these things that's going to make a massive difference, and it already does. It's just not well understood amongst all the hype and noise. And so I think the best way to provide a clear example of what I mean by this is to give you an example. So and Beck, are you a clinical OT, a clinical OT assistant, physio assistant? Where do you sit in the world? If you put in that message, I can maybe tailor it a little bit. There we come. And in the meantime, I'll make a phone call. So I see Beck's typing. Sorry, Beck. I've put you on the spot, haven't I? Oh, Alfred, brilliant. Brilliant. Alfred's a great hospital. My last business did a lot with Alfred. So in the context of this, think about outside the hospital. So you've made a decision to help someone. They're leaving the hospital environment, and you're thinking about how to check in with this person and manage your time as much as you can, right? So really take this in and think about all the different ways this can apply to you. Good day, Bethia. And I'll just make this phone call.
Hey, it's Deb from AI Carer. To confirm your identity, could you please tell me your full name and your date of birth?
Yeah, my name is Yazz Krishna, and my date of birth is 29th of the 10th, 1984.
Thanks for that. I'm just checking that now. Hi, Yazz. Thanks for confirming your ID. I'm just checking in. How are you today?
I'm doing well. Hey, I'm just doing a presentation. Can we make it quick?
I'm well, thanks. Sure, let's keep this brief. I'm calling for the usual check. I've noticed your sleep has been lower than usual, and your resting heart rate and breathing are a touch higher. Are you feeling unwell or worried about anything?
No, I'm okay. Look, I'm in this presentation, so I'm probably just a bit stressed more than usual, but thank you for the call.
Got it. That explains it. Your other health metrics look steady. Thanks for the chat. I'll summarize this and send it to your care team. If there's nothing else, I'll check in again next week.
Thank you.
Take care.
Appreciate it. Bye. Now, I'll make a second phone call really quickly.
Hi, it's Deb from AI Carer. To confirm your identity, could you please tell me your full name and your date of birth?
Yeah, look, no, I'm not feeling great. No, I don't know. I'm just not feeling great.
I'm really sorry to hear that. That sounds tough. Could you please provide your full name and date of birth so I can help you better?
No, look, I just think I need help.
That's okay. No worries at all. Let me connect you with one of our team members who can help you better. Please stay on the line. Take care.
So the reason I made that second call is to elicit usually the first problem that people have, which is what if it's an emergency? What if there's something significant going on and we need to take action? This is what AI is able to do. It's very easy for us to train AI to handle context in different ways, such as passing an emergency call to emergency services and dealing with those high-risk items on the workflow that you suggest. But more broadly than that, what does it do to our ability to care? What does it do for our ability to care with folk if we have no limit on how often we can touch base with them? Because right now, for us to do this properly, it requires your time, and that is very difficult for you to measure. But if you ask yourself, what would you like to do if time wasn't a measure? You might decide that you should really check in with someone every day, set them some goals. And then also, what happens if you can start to not only track what they're up to, and when I say track, I mean be able to understand changes in their behavior between your visits. If you do a home visit or they come to an appointment, what's happening between is really, really important. It's unlikely that they're necessarily going to be honest with you. And I'll have a personal story there. So if you believed in this tool and we got past all the barriers that exist, what does that do for your ability to care for more people, the quality of care? If you, before seeing me, could review a report that said, this week I have really not moved, I haven't walked, I haven't sort of taken any steps, I've slept a lot longer than I normally sleep, and I haven't left the house. You knowing that, will that adjust your questions that you might ask me when you're when I come for an appointment? Does that allow you to tailor your care a bit better? Usually the answer to this is yes. And this is the important bit of this. The other element is what happens when you virtualize this in regional Australia and regional areas. You can provide a virtual consult as well, but how do you sort of help them over time? The second to this is your ability to interact with the patient. If you are able to take notes, structure them in a certain way, review them in whatever way, and have this happen, or you have an assistant that you can call that can give you information and supply you with the ability to automate some of your administrative paperwork, what does that do for you? These are all the questions it's worth really reviewing as you look at how AI can manage this, right? And there's just an example of one of these calls being summarized in a very specific way, telling you the sentiment, what happened, the notes, any health observations, and all of that, and presenting that to you as a story. This is what AI can do. So if we really think about this, that call was a conversational call. It didn't sound like a robot. It did not just follow a tree. It was able to respond to my comments, confirm, accept, deny, all that stuff. It asks the right questions, and you can control what questions it asks. You can control the options, and you can control what to do depending on what they answer. And you can schedule those calls. Or better yet, leverage technology like wearables, which are now very, very low cost, and be able to then bring in automation, like know their heart rate, breathing, stress levels, and make decisions based on that. So imagine if you set a goal for someone to go for a walk each day as part of their healthy habits, and they missed it. Wouldn't it be interesting if you could give them a call and just give them a nudge? Hey, is everything okay? I've noticed you've missed your walk. Is there anything I can do? Any of that type of stuff, right? Imagine if that was automated. And then you may not be funded to be able to deal with all those escalations. But it's very interesting when you start to bring family and other carers into this and you go, look, I'm setting the rules and I'm setting the goals. And with the permission of the person, if their goals are slipping a whole bunch or things aren't happening or things are weird, maybe you don't have the time or funding to deal with it, but maybe a family member does. And they can also be brought into this care journey in order to improve. And finally, you can summarize that information and make that available wherever it needs to go. It is in this that you have the opportunity available to you. And it's not really, again, about the replacement of staff. It is very difficult to do something like that. But how do we make you a lot more effective in your ability to deliver service and also turn a lot of your day into data? And what that means is it helps justify, it helps write any escalation processes, any of that activity that you do. It's steeped in data and tracking. And this really helps decision making in terms of how you want to care for any sort of case that you're building. Or indeed, if you're using this as a way to suggest a reassessment for someone in care or home care package or NDIS or any of that fun stuff that you need to deal with, right? And this was known, but this is what I mean by it's not about replacing people. It's that there simply is not enough people to do the job that you guys are doing. And it's not going to get better because unfortunately we have not produced enough children that can grow up to be the carers that we need at the moment. So it's not a case of will this thing change our jobs or take it. It's a thing of for the number of new elderly folk in particular. I know elderly is not the only thing that we do, but it's one of the major ones. We're adding them onto this world faster than we can care for them. And this is a real problem because it's not the same case that there's that many people entering the workforce. And this is a challenge at federal government to state government to local government is something that we can't get around. And this again is where AI becomes that tool to augment things that otherwise you're not able to do. And you can go through politicians and how they're approaching this. You know, how do we figure out visas to bring people in from overseas? Is there faster training, which usually has a quality issue? Can we try to increase pay and conditions? Is there more funding we can provide? All of these are great strategies, but none of them can close the gap fast enough. So in other areas, the real question becomes, instead of how do we find more people to do the job, how do we help the people doing the job get a lot further with their time and their capability, right? And there's two layers. Can we reduce the geographical boundaries of care? And can we prioritize the care that we provide based on the needs of the person as opposed to events that occur or a scheduled sort of appointment? And finally, when a scheduled appointment occurs, how can we make that appointment as valuable and useful as it can be? And these are all the things that AI is able to do at scale and really quickly. So we can pause on that and sort of talk about my background. So my background is in digital health. I previously had a business called Five Faces that we grew across the hospital and healthcare space. Alfred's a good customer of ours back in the day. And ultimately, which at the time was the reason Australia opened, now people have different opinions on it. We were the solution that powered the mass vaccination centers from a digital perspective. That's onboarding people, getting them into the hospitals, getting them jabbed, tracking the adverse reactions, if any, there applies for it. We also managed the COVID response in airports, the military force, and all of that, with over 12 million Australians going through our systems. And before ML was a thing and AI was a thing, we were using those same algorithms to figure out predictive ability on how many of the syringes we should fill. Because once you filled a syringe and it did not apply to a patient, you had to throw it away. And at the time, these COVID vaccinations were in high demand. So each of those vials were really important. So as a result, our initiative ended up being 18% more efficient than any other initiative in the world, and we vaccinated 12 million Australians and helped open up the country. I sold that business in 2021, and retirement was very, very boring. And it was in that moment that my dad was staying behind me in the granny flat. And see, my dad had a bit of a fall and he kind of got stuck. And he wasn't wearing that fall pendant. The challenge with these fall pendants and these fall wrist devices is they look quite clinical. And they also don't really tell you properly if they're wearing it or not. So, of course, my dad, being the manly man that he is, he chose not to wear his fall pendant that day. And as a result, he got stuck. It was only lucky that we found him and got him to a hospital in time. He had a broken shoulder and he was dehydrated. Brisbane heat can be pretty offensive. But we got him there and everything was kind of okay. But it was in that moment that they discovered that he also had early signs of dementia and he had advancing heart disease. You see, we're a pretty close-knit family. But we did not know. We visit him every week. We had no idea. And this is simply because my dad isn't honest. He didn't want to explain his troubles. And when his home care provider would come visit him and all of these things, they typically start off by asking, how are you? How's your week? Is everything okay? And my dad would always just say yes. Nothing was ever wrong with this guy, right? And so as a result, we didn't pick this up. And I remember the doctor telling me this quite blasé about the whole thing. He said, if we knew about this early, there's a ton of things we can do. But now that we've picked it up a little bit late, now it's all management. And that's something that resonated with me, and I do carry a bit of guilt around that, is the fact that, look, I visit my dad, my whole family sort of visit, all of that. This wasn't a case of neglect. It was just ignorance. We didn't know. And so what can we do was my question to myself. What can we do to get better at this? And there's a couple of answers for that. One was, firstly, we need to deal with the stigma. So let's not use these proprietary medical devices. There are that many smartwatches and other devices out there. But equally than that, well, how do we build a model around an individual? See, I'm not necessarily worried about solving world hunger. I want to know when my dad needs help. So thankfully, my cousin brother, it was actually the ex-head of AI for Google. So I reached out to him, and his mother passed away in India. She fell in the bathroom, and she was not found. And it was really quite impactful, as you can imagine. And both of us sort of combined ourselves and put way too much money into it. And this is how AI Care was born as a business. And it's all on the idea of what is that decline that occurs, and how can we get ahead of it by letting you, the people caring for them, know the things that you can't see. Because you can only visit them once a week, maybe twice a week, maybe they visit you for a fortnight. But life happens between those 2 weeks. And unless they're willing to share, which it does not appear to be common, you're simply not going to know about it until something happens to their body that you're able to pick up and then act upon, right? And that's kind of the philosophy that we have around this, right? I think it's worth saying out loud is because there's a lot of noise about jobs, right? In the healthcare sector, it's all about augmentation. Although the rise of the robots might be here, it's going to be a while before they're going into people's homes and doing things, right? So it's more about how we make it easier for you to do more than it is about trying to replace your ability to do stuff, right? Because again, maybe there's a day where our elderly will trust robots, but I don't think that day is soon. And neither are the robots there yet. Hands-on care is still a human activity. Judgment in context is really hard. Reading a room, a mood, getting a feel, and then present. These are things that, at least at the moment, you don't want to say never in this world. It's changing so fast, but we're a while away from that. But what we can do is augment this so that you can do more of this and less of the paperwork that goes around it. So as mentioned, imagine a scenario here where you get a report emailed to you on an app, whatever methodology that you're after, that tells you a summary of how this person's life was tracking. Not life tracking based on some clinical measure, on their normal. Because we can have very accurate baselines over data. And so although I might be overweight and therefore very fit, whereas someone like Ty that I saw earlier looks quite fit, we might have different heart rates. And that's okay. That's our normal, right? But if my heart rate suddenly jumps up, this is a problem. So for me, maybe 100 beats per minute as a heart rate is not really a concern. For Ty that might have a resting heart rate of 60, that's a major concern. So the AI models are built around the individual, not a population. And what we're really doing is comparing what their normal looks like as time goes on. And this allows us to get immensely good at seeing trends that result in deterioration and give you a summary in plain English, as well as all the data you can need if you are one of those people that need it. So you can see here how Joanna, we've summarized her last week. We're looking at her trends over time. We're seeing how much she's walking, her vitals against her baseline, and her sleep patterns. And this allows you to make a better decision, ask the right questions when you visit. And we can tailor a lot of this to the goals that you set for that person. Equally, when you visit someone or you provide some care, how much note-taking, paperwork, activities are you doing off the back of that? I don't know what the answer is, but let's assume it's not zero. Imagine if you have an assistant that you can call and you can just talk through, either during an appointment or after an appointment if the patient is not comfortable, that you can have just a conversation with, and they will summarize it in the right format with the right words, send you that so you can just give it a quick look and a quick tick, and you can get on with the next job that you have, right? These are all opportunities there for you, should you want to embrace technology like this, right? And this also goes into patterns in drifting behavior. And finally, flagging changes that are early. If I'm usually walking 3,000 steps a day, 5,000 steps a day every day, and over the last month it's gone down to 500 to 1,000, something has happened in my life. It may not be physical, it might be mental, we don't know, but a simple line of inquiry is all that it takes for me to potentially get the help that I need before I end up in hospital or before I end up in a more acute situation that occurs, right? And as mentioned, you might visit, or they might visit you once a week, twice a week, but there's a lot of hours that nobody sees. And this is of worse of people that are living on their own, where family don't necessarily see. Or in the case of my dad, we like to think we're a very caring family. We just don't know what to look for because we're not professional. And so we miss some very obvious signs, right? And this is what AI is able to do, and what we've sort of built a business around is, can we be your eyes and ears when you are not there? And can we give you useful context when you do turn up, or when they turn up, to allow you to make better decisions, ask better questions? And then goal setting. I was speaking to someone in an eating disorder specialty, and he said his number one problem is he has to be able to decipher whether his patient is lying or not, and that's half of his battle. He goes, if the patient is honest, he knows what to do, but that's kind of the hard part, right? So the ability for us to call, ask questions, check in, look at their biometrics, we can give you an idea around honesty, such as they haven't got better, but they haven't followed your rehabilitation advice, they haven't stretched, they haven't done the walk, any of those things. This can help you ask better questions, maybe adjust your treatment plan, put the right recommendation forward. All of that sort of stems off this knowledge of continuity that we're able to provide, right? And this is what I mean by the combination, is when you combine these tools with the human being, you now have the ability to have context. The AI will not get it right all the time, but they will get the data right. They won't get the interpretation, but you can, because you know the person, you'll have an idea on what's going on, and you can make better decisions, right? So within the context of this, if you are looking at these types of things, one of the main things is around sovereignty. It is very easy, and I know some of you will be doing this even though you may not admit to it. You might be dumping some stuff in ChatGPT or Claude and getting help, and it is very, very useful. But there's a whole range of privacy issues that you're breaching by doing that on data sovereignty and things like that. Beware of any AI system that tells you that it's going to decide. That's regulated, and it's a dangerous claim to live. However, anything that's informing can be quite useful. Asking the questions around data. Are you sovereign in Australia? Are you built on ISO standards? Are you Australian privacy principles compliant? This is all guiding forces. Nothing replaces your eyes. And again, any escalations just happen the way you have. This is just another tool set in your book that you can then utilize. So in terms of any sort of AI tool, what does it actually do? Be aware of anything that claims a diagnosis. We have processes for that. Ask where the data is stored. Also, if they are taking any action, who is accountable for that action? Does it fit in your delegation and scope? And is it giving you time back? That's the best one. Are you providing better care? Is it managing your time better? Or is it creating more work for you? And is that more work not really translating to patient output, right? And those are kind of really important questions to think about when embracing the technology. So my specific business, we believe in two things. We believe that these cheap wearables, be it Garmin, be it Samsung, it doesn't matter. At the moment, those two will expand it out. Get one of those. They can be as low as $200 and as high as a couple of thousand, depending on how fancy you want the thing. This now allows us to build models of data around an individual. If they don't want to wear a watch, then we still have the ability for conversational AI to call them. You can set schedules. I want to call them at 9 a.m. every day to check in on this, once a week, any of those things.
Excuse me, Yazz.
Yeah,
Is that part of the subscription?
It is part of the subscription up to 30 minutes.
Okay, excellent. So I wasn't aware of that.
Yeah, it's there for you as well. Yeah, absolutely. So, and you can set it up to 30 minutes and you pay for credits if you need more. And this can be everything as simple as you're going away on holidays. You're going to be out in the bush or out in wherever. You're worried about your mom. You're worried about your dad. Imagine a call that checks in every day and it gives you a summary. And the summary for us tells you very clearly if the call went well or didn't go well. So now you can just get that report and know, okay, cool, I can enjoy my holiday. Mum's kind of okay. And I'm going to know if mum's not okay. And then I can take the time to give him a call, right? And finally, these patterns get to surface that allow you to intervene and set these goals, right? So the goal for us is not about diagnosis. That is not what we're interested in doing. We have clinicians and all of these tools that clinicians have to do a really great job. What we're trying to do is how do we provide our carers and our allied health professionals, how do we provide a bit of an early warning sign, or what we call the canary in a coal mine, to say something is happening and you just need to ask some questions? Because we know if you ask the questions and you get them to the clinical support relevant, actually our healthcare system is pretty darn good at dealing with early intervention. The problem is not our clinical system, it's human beings that do the age-old thing of, oh, geez, I cut myself, it's getting a bit pussy, don't worry about it, I'll wait a week, right? And this is what causes the most significant problem that ends up resulting in our hospitalizations and everything like that. And we believe this is the approach that's very sustainable. And what's more interesting is all of this is now funded. We have an initiative with Carers Queensland. That was a pilot that we ran earlier in the year. And the outcomes were absolutely incredible in terms of what we were able to do, which we were very lucky to have. Carers Queensland, thanks to them, have funded us to the unpaid carers in Queensland. And our devices and our package has been claimed on NDIS, has been claimed on the home care packages of people. Some home care providers are augmenting their services and charging fees for it. It turns out, for professionals that know it, this is not something that you have to necessarily spend on. This is something that can come out of the packages of the person you're caring for. And it's a pretty low cost type of items here. We're talking a couple of $100. It's not massive expenses that's there. I think I've spent enough time on that. Anyway, so I might pause there and take any questions, have a discussion, anything